After the exams, you are to concentrate on the nursing process. You can jot down, make your jottings if you feel that you need to. So we're going to be talking about the benefits of the nursing process. And can anyone tell me what the benefits of the nursing process are? Anybody? Or you don't start studying yet, you never learned anything. What are the benefits of the nursing process? Why you need the nursing process?
It's for holistic patient care.
But I want you to simplify them. What does the nursing process do? What are the benefits of the nursing process?
Is to promote quality care for patients.
Is it identify the problem that the patient is having, and it helps you to make plans, to make appropriate plans to treat the problem or to address the problem that the patient is having.
Wonderful. Anything else? Anything else?
Is to promote quality care for the patient, to ensure that you understand the patient needs and help the patient to improve into getting their illness over so they can go home and recuperate.
I want you to, when I ask you the questions, I want you to answer me as if you were writing them. So one of the major problems that we had in the last exams were that you were writing in your own words too much somewhat, and the points were too much fragmented, and there was repetition of points. So even if you write on a whole page and all the points that you put in meant the same thing, you wouldn't have gotten the marks for them. So let me just go over them. So the benefits of the nursing process, for example, is to identify the status, the health status of the patient, whether it is an actual problem or a potential problem, right? So to identify the health status of the patient so that you can give quick interventions for the optimal recovery of the patient. So that is one benefit, identifying what is wrong with the patient, the health status of the patient. Right? It also provides an organized framework that allows for persons to give continuous care in collaboration with other members of the health team members in order for the patients to have improvement in their health. Right? The nursing process also provides a method by which structured decision making can be done in order to deliver. So when you're having the nursing process now, you're delivering specific interventions to meet the specific needs of individual patients. We also have nursing process serves as a measure for accountability of the nursing action, so that in order to improve the care, the quality of care that is given for the patient. Another benefit of the nursing process basically is for active client involvement or participation. So when the patient is actively involved in the care, it leads to them getting better quicker or recovering quicker. So recovering quicker, and not only quicker, but it allows them as well to have the most optimal modes of recovery. So when the nursing process, it allows for optimal recovery when there is client involvement. Remember too that the nursing process is a means by which common language is spoken by all nurses, right? So everybody knows that in order for the steps of the nursing process, assessment, diagnosis of the problem, we're going to plan the care that is given to them, we're going to implement the interventions, and then we're going to now go to evaluate the care that was given to the patient to see whether or not the patient had improved, or if the situation has remained the same, or if their situation has worsened, so that we can now intervene more wholesomely to give continuous care or interventions to improve their health status. So it provides a common language used by nurses to improve the quality of care that we give. Another benefit of the nursing process is also when we're thinking about economic contributions then. So we have the nursing process fees this structure will allow us to plan effectively so that we don't waste resources, so that we know what it is that we have available to us, so we use the appropriate resources. So it limits overuse of resources then, and thus delivering care systematically. All right, so I understand now? You understand now? You all understand now?
Yes, miss. Yes, miss.
All right, so the benefits of the nursing process, you need to be aware of that. All right, another thing that we need to you need to pay attention to is the activities now. So when you're assessing the patient, you know the different phases of the nursing process, and we went through them. What are them? What are they again?
Assessment, diagnosis, implementation, and evaluation.
All right, all right. So what are some of the things that you do when you're What are the things that you do when you are in the assessment phase of the nursing process? When you're assessing the patient, what are some of the activities that you have to conduct in order for you to come to for you to complete the assessment phase of the nursing process? What are some of the activities that you have to conduct?
Ask questions.
Yes, you review the client health record.
Okay, so you review the client health record. What else you do?
Health history. You conduct physical assessment.
Jody not coming on. All right, go ahead, Kimola.
So you'll review their health history and then you'll conduct physical assessment. And you consult their support personnel.
Oh yeah, get it. So all right. So in that activity now, that is the first thing that you do. So these are so when you're collecting the health history, when you are conducting your physical assessment, when you are consulting other support persons who are integral in the care of the patient, other support persons to find out, you know, what exactly is wrong with the patient. What are you trying to do right there? You have it in front of you, Kimola, because I see you're reading that slide. So first you want to establish phase of the nursing process. So when you are collecting data in the assessment phase of the nursing process, what you do. But first, I want to see if I can stimulate your memory a little bit, for you to tell me what are the things that you do in the assessment phase of the nursing process. Somebody mentioned collecting of data, but there are different steps. There's a slide there that speaks about the steps to the nursing process. The steps of the nursing process, and in the assessment phase, what is done, in the diagnosis phase, what's done, in the planning, implementation, and evaluation phase of the nursing process, exactly what is done. So I want for you to tell me now, in the assessment phase of the nursing process, what and what you do.
Miss, you're going to establish.
So Kimola, you were saying that you collected the data answer. So under which phase that? Go ahead, man. Stephanie, that was you?
Yes, miss.
It is not this.
Miss, you're going to establish.
Okay.
You're going to establish a database for the client. So this includes collecting the client's biographic data, past medical history, their next of.
So that is all collecting all of the histories. So yes, collecting all of the histories.
Yes, miss.
Mm-hmm. What else? After you collect the history, what else you do to get the data?
We're going to check other medical records.
All right. And what you're looking for in the records of the patient?
You're looking if they are
if they have been admitted before, if they're on any medication.
Okay, all right, so that is two things you do when you're collecting the data. What else you do? So you get all of the histories of the patient to establish exactly who they are. So where they live, the medical histories, the immunization, all of those histories you're gonna be getting. And then now you say you're going to review record because you're going to collect data and you're getting to know the patient to find out exactly what's wrong with them. And then what else you do again? When you talk to me now, because the paper set, so they can stay there, listen for me to belch out the information given you. Come. What else you do? Am I still on?
Yes, miss, you're still on.
Remember that I'm not seeing the video, so I don't see. What else you do?
Is there only data as needed?
No, not there, sir. Not there, sir. Not already there, sir, yet.
Miss, you also review literature too, miss.
You review the literature. Why you review the literature, Mola? Very good.
Miss, to know the...
You review the literature, so basically, literature, what you mean then? You mean books?
Miss, like review books, miss, things about the illness
condition that you find. No.
Yes, miss.
And you also, and when you're talking about things that you find, you have to conduct a physical assessment, don't it?
Yes, miss.
So when you're collecting data, let me review again with you. When you're collecting data or when you're trying to establish a database for the patient. So you have a patient who comes into you, you don't know anything about them. Right? This is the first time this patient is coming to you. You want to, and as part of the assessment, as part of you assessing the patient, you're gonna collect all of the history from the patient. To establish, you collect the histories basically to establish what is wrong with the patient, what could have caused the patient to be so predisposed to their current condition, what could have possibly been the risk factor. That is why you collect all the data, You collect the immunization from the patient, immunization status of the patient, for example, to find out if the patient come in with rashes and all of those things. You're going to be collecting the immunization status because you want to find out was the patient immunized against measles, because that's a sign and symptom of measles. If in our current state, the patient comes in with a cough or a cold, you're going to find out were you immunized against COVID-19? Were you immunized against have you had your OPV vaccine? Because all of those illnesses would have been flu-related illnesses. So that is why you would collect the immunization status. So ladies, I want you to understand why exactly you would collect what information from the patient. That's what I want to get at, right? So in establishing the database, or when you're collecting the data, you're going to collect all the nursing health histories from the patients, right? You're going to conduct a physical assessment. If you don't conduct the assessment of the patient, the head to toe, you're going to examine the patient from head to toe. You're not going to find out what is wrong with them, right? You're not going to have any data or what we would say baseline data. You're going to review the records of the patient, the client records. You're going to review literature because you don't know everything. So you're going to review literature to synchronize the theory now to what is exactly your finding when you assess the patient from their head to their toe. You're going to be consulting other healthcare professionals. So if the patient needs a nutritionist, if the patient needs to see a surgeon, if they need to see a physiotherapist or so, you're going to be or the doctor. So the doctor would have been the person or you would have communicated with instantaneously when you do an assessment of the patient, when you collect the data from the patient. You collect the data from the patient, you notice any abnormalities that are present. The quickest person for you to consult is the doctor. You assess the patient and you notice the blood pressure is being elevated. You get an elevated reading. When you flip through the records, you see previous admission. You see that the patient has been diagnosed with hypertension. You see how many years ago that they have been diagnosed with the condition. So you're going to be asking, that would lead you to be asking other pertinent questions to find out how it is that you go about taking care of this particular patient. Then so number one, you collect the data or establish the database, right? So that is the first thing you do in the assessment process. The next thing that you would do in the assessment process is to organize the data that you have gotten. Right? So organize the data that you have gotten. And the parts when I don't want you to, when you're answering the questions, I want you to write pointers. So first, for example, you would say, what are the activities of the nursing process, of the assessment phase of the nursing process? So number one activity would be to collect the data. So you write collect the data. Underneath collection of data, tell me how you're going to collect the data, what data you're going to be collecting. So in order to collect data, you're going to put another point, you're going to conduct physical assessment. You're going to collect all the nursing histories, including biographic data, so on and so forth. You're going to be reviewing the health records. You're going to be reviewing nursing literature. You're going to be consulting with support persons and healthcare professionals. And you can add meat to the bone right there. Do you understand me?
Yes, miss.
Yes,
All right?
miss.
All right, so that is number one activity in the assessment process. Then the next activity, when you get all of that data now, you collect all of the data now, you're going to organize the data. When you're organizing the data, what it is that you do? Anybody see what the guy name? Is he on? Grave? Did you get the chance to, do you know if he knows that where he's supposed to be on? And I still don't.
Miss, I'm not sure if you, I sent the message in the group.
Grave?
Yes, miss, I'm hearing. I sent the message in the group, miss, so I'm not sure why he's not.
I don't see Grave. Stephanie?
Yes, miss, I'm hearing you. How about you guys?
Alright. So, alright, so the next thing that you do in the assessment phase of the nursing process is to organize the data. And when you are organizing the data, what you do? When you organize the information, what you do? Remember now, you the nursing process, you soon got is a care plan you're making now, but you're doing the assessment now. So when you organize the data, what you do? What you do?
Group the findings, miss, like signs and symptoms.
Okay, so you group the findings, the signs and symptoms, you group them. What else you would do? What else you do? You identify patterns. When you say so that is one. So you, all right, let me go back to the grouping. So you group or organize the data based on the hierarchy of needs, for example. All right, so you group the data. So you group the data or you cluster. I hearing Jody's voice saying, Miss, you cluster the clues, you cluster them. So that is one thing that you do. You organize or you cluster the data together according to the hierarchy of needs. When you do that as well, in organizing the data, you now learn to identify any patterns, any existing patterns of problems that you would have identified, right? So you so you identify the cues, or you would have identified any patterns that would have existed. And another thing that you do know, you determine the structure. That is the structure of assessment that is used by the different agencies. So the two things that you do, you would group the data or cluster the data, and then you would identify the cues. Understand? So that is how you organize it. Don't.
Yes, miss.
Then after you group it now, what you do again? Come faster. What you do? You validate it. So when you're validating the data now, you're going to say, boy, the patient is, you're validating to see if what the patient said to you, the subjective matches with the objective assessment, assessment data. Patient might telling you that, oh, they're having pain and they're having pain rated 8 out of 10, for example. But, or they're telling you, for example, simple, they're telling you that they're happy. But when you look on the facial expression, you don't see happiness there. Right? So you would scrutinize the data because you want to note congruence. You want to see if it matches up. So you want to note congruence of objective data and the subjective data. When you're validating the data now, you clarify anything that is ambiguous. So you clarify any ambiguous statements. What do I mean by that? Anybody? When you clarify ambiguous statements, what it is that I mean by that?
So that would mean like statements that might have the same meaning or someone might take it different.
Yes, so you want to find out if things that are not clear. So if the patient, that is why we say when you're assessing the patient, when you're interviewing the patient, you speak in terms that the patient may understand. You try to understand what the patient means. So if it is that they tell you something that you're not so clear on, you're going to clarify it. So that means what they're saying is what you think they mean. Because remember, everybody is different, you know. So how I think may not be as how you think. So you're going to clarify ambiguous statements. You're going to ensure that you determine if the data is complete or if you need additional data to accurately to diagnose the patient's problem. You're also going to ensure that you discriminate between cues and inferences. You identify or you note the difference between cues and inferences. So you're going to differentiate between cues and inferences, such as the nurse's interpretation. So that is why I said that you can't guess anything. When a patient is talking to you, you listen to what they are saying, not to what you are thinking per se, because you need to differentiate between the cue that is given and what you are inferring, what you are thinking is happening, and you do that to avoid any opinions, right? So you differentiate between cues and what we say judgments. Then give you another common term, judgments. Then to avoid any opinions. So you don't come up with your own opinion, right? You tend to ascertain if what is happening with the patient is factual. Right, so that is why we say you can't say not because the patient is not crying. You're not gonna say the patient is not having any pain or a lie might tell him not feel no pain. Right, so you're going to differentiate between cues and judgments, and you do this to avoid any opinions, person's opinions. You are going to ensure that you you're going to be checking for factors for anything that may cause any inaccurate data. So you're going to check for any factors that may interfere with data. Am I online still?
Yes, please.
Yes, miss.
All right. My system not working so well. So you're going to be checking for any factors or anything that any circumstances, any issues that may interfere with accuracy of the data. So for example, you're gonna ensure that the identity of the client, you're gonna ensure that there are no generalized statements, you're gonna be ensuring that there is no judgmental statements that are made. You understand me? You understanding me?
Miss.
Yes,
Everybody's
Miss.
understanding me? All
Yes,
right.
Miss.
All right. Then now you pay attention to references. You use references. And when I say you use references, I mean that in validating the data, this is no when you're going to be checking the literature to ensure to ensure that it is in congruence with the facts. So it's not anything guess, it's not what Miss Jackson says. It's what actually the literature is saying. Everybody understand me?
Yes, Miss.
Yes, Miss.
Yes, Miss.
The same voices me hear I say yes now, you can stay there. Alright. Then now, in the last aspect of it now, this is when you document or you communicate whatever data that you have gotten. And when you are documenting now, you're now going to use the principles of documentation. And what are the principles of documentation that you're going to use when you are recording data? Tell me the principles of documentation that you bear in mind.
Information should be factual.
Accurate and concise.
Miss gone offline.
Information should be clear, Miss.
Miss.
Yes, Miss.
I joined on my phone. All right. So then now, after you've collected the data, you've validated the data, you've organized the data, validated the data, then now you are going to document or communicate the data. What are some of the things that you do when you're communicating the data? And I mentioned that you utilize, so you would use the principles. Number one, you utilize the principles of documentation. What are the principles of documentation? What are the guidelines of documentation?
Information should be accurate.
Mm-hmm. Yes.
Miss, it should be in a sequence. Miss, event should be recorded in the sequence of how they happen.
Okay, sequential. Mm-hmm.
It should be complete. It should be factual, clear and concise. And it should be relevant.
Okay. All right. So it ensure that it is identifiable. So that means that it is clear, identifiable or clear. All right. Hold on. So it is accurate, sequential, concise. What again?
Miss, it should be legible. The grammar should be correct. Miss, it should be easy to read. It should not be
All right,
figuring.
hold on. So it should be legible. Legible. What else? Easy to read. What do you mean again? Come, repeat what you said, nurse.
You shouldn't be figuring out what is what. That means it should be
Tell me the terms.
common language that nurses understand. That is universal. There should be a common language that you use. And it should be legible, so you should be not be guessing what it was written.
All right, so it should be legible. It should be complete. It should be factual. It should be accurate. It should be sequential. It should be concise. It should have what? Signature.
Yes, Miss, and it also should be what the client stated.
So hold on to that thought. So it should be identifiable. So that means your signature should be there. Go on, Miss Bowen.
Miss, I was saying it should be what the client stated, not what the nurse said.
So factual would cover that. Factual would cover that. So you're saying unopinionated then, unopinionated. Okay, unopinionated. Oh,
Must be updated.
non-ambiguous or unopinionated or non-ambiguous. Non-ambiguous, ambiguous, or unopinionated. Okay. Go ahead. Anything else?
Miss, and you mustn't use any jargons either, miss.
Okay. So. Non-ambiguated. There is a word that's non-ambiguous or unambiguous.
Ambiguous, miss.
It is unambiguous. Unambiguous or unopinionated. Free from jargons. Free from jargons. All right. So that is one step, and then you, in order when you're communicating data, other than writing, you would give verbal reports as needed. Understand me now? So first, Stephanie, tell me now, what are the steps that are in the nurse assessment phase of the nursing process? In a synopsis, tell me what you remember. Or anybody, quickly. Remember, I don't have much time enough. Coming up at now 6 o'clock. Come.
Subjective and objective data, miss, and chief complaint.
Who you talk say? How would this?
So, Miss,
Go ahead.
Miss, so in the assessment phase, you know, you establish a database. You would have your health history, your nursing history, and you know you'll perform physical assessment. Um, you will organize your data. When you organize the data now, you identify pattern. If identify specific patterns, you group your findings. After you will validate your data.
That is organizing. And then you would validate your data.
Validate, yes, miss. You will ensure to check for things that can cause inaccurate information, inaccuracy.
Mm-hmm.
You'll clarify things that are not so clear in that.
Mm-hmm.
And the last one, you'll communicate or you will document your data. Your information should be accurate, factual, that is. It should be completed. It must be it must be legible. And identifiable.
All right. Thank you so much, Miss McCray. All right. So you need to, all of you need to review that now. All right. Another thing now. You're going to be getting the next topic on the so one is the nursing process and more specifically to the assessment phase now. All right. So tell me now. So you the assessment phase now. So when you're implementing now during the implementation or the interventions, the implementation phase of the nursing process, what is it that you as the nurse should consider? When you're going to give the care for the patient, so you assess the patient now, and now you're going to give care. Tell me 4 of your nursing considerations. What are some of the things that you would need to do when you are considering to implement those specific interventions?
We should have to reassess the client to update the database.
All right, come. Mm-hmm. So you reassess it. Mm-hmm. Go ahead.
Yes, miss. And after that, you would determine the nurse for assistance. And you will perform planned nursing intervention and communicate the implemented nursing actions also.
Okay, so that is when you're reassessing the patient. So when you assess the patient now, and you're going to start intervening now. So you did the patient's blood pressure in the morning, right? And now you're going to give the pill now. You're going to pill now. So first, you have to reassess the patient to ensure that the patient still need the pill, need the pill. So when you're going to do that now, you're going to reassess the patient, and when you reassess the patient, you have now to update whatever database is there, and then you're going to determine any specific change in the condition of the patient to ensure that the interventions that you're going to be carrying out now is still relevant, or you need to change the interventions. You also reassess the patients because the interventions may need to be changed or altered if new data is given by the client. So sometimes you're going to assess the patient, and when you're going to be doing what you need to do now, them come and say, no, miss, I got the medication already. I know me not feel no pain again. So me not really want no pain medication. Right? So you reassess the patient every time. Right? Then after you reassess the patient, now you are going to do what now, Macri?
You will determine the nurse need for assistance.
All right, this is where you get information, Macri, because I must say you wanted in the class. Where you get it?
Miss, when you were in that specific class, I was jotting down.
All right, all right, all right. So you determine if the nurse needs any assistance. So in this instance, no, you would have identified the limitations of the client to determine what kind of help you would need. So if it is that the patient has had a severe stroke and they can't move, you're gonna determine what are the limitations of the patient and what assistance that you would need. In that same breath now, you're going to gather the resources, the resources that you would need in order to implement, in order to do the interventions. So you would gather the adequate resources. So whether it's somebody you're going to need, or whether you're going to need other physical things, so whether human or physical resources, and then now you are going to determine the level of knowledge and the skills that is needed to perform the interventions. So if you're going to do something for the patient and you realize that you don't know much about it, you're not going to run go fling the two pill and give the patient because you don't know what you don't know about the medication. You don't know about the pill, so you're going to read up first. So you're going to determine the level of knowledge and skills that are needed to perform the interventions appropriately. Am I clear?
Yes, miss.
All right. When you're doing something for the patient, no. The revision session is not to teach, and not for you to just sit down in the class, just sit down the whole time. You understand? And say a belt out like how my prayer belt out to me here so now. Then what is another thing that you do under the implementation phase of the nursing process? What else do you do? The two things you tell me, you reassess the patient. Come, Macrae, it's me and you in the class. You reassess the patient, you determine if the nurse need assistance. What else you do?
You perform your planned nursing intervention now after you determine the nurse needs for assistance.
All right. You don't have to be after. You understand? You don't have to come in any sequence, Macrae. But you just need to understand that when you're going to implement care, when you're going to do something for the patient, these are the things you do. So now you would go ahead now, and you would plan the well, in this case it would be after. You would perform the interventions. So it's either you do it yourself, because it can be delegated according to your scope of practice, because there is not everything that needs to be done for the patient that you can do. What if there are interventions there that you realize that it is not within your scope? So it can be delegated according to the scope of practice, but the approach is to complete the task. So you conduct or delegate planned interventions. All right. So you can conduct, delegate, or conduct planned interventions. Right? So determine the level based on the all right, so you conduct or you what else? What else? What else?
We have to involve
All right,
the
so
patient.
the next step is if you communicate the implemented nursing actions.
All right. But okay, thank you so much, Nicole. But before that as well, you can also after you can assess safety, ensure safety during the intervention. So you must have knowledge of the expected side effects of interventions or potential problems. So when you're conducting the interventions, when you're doing the things for the patients, you have to have knowledge of the side effects. What can happen? What can be a complication? What can go wrong while you are conducting these interventions? So you're giving the patient the medication. You have to have assessed the level of patient's level of safety. Based on the side effects of the medication. For example, you know that it made the patient drowsy, so you're gonna ensure say that you elevate the bed rails so that the patient don't jump out of bed. You're going to ensure that the patient's environment is safe. You advise the patient, for example, to stay in bed, that sort of thing. So after you so when you're planning the intervention, when you perform the intervention, whether or not you're going to do it yourself or you're going to delegate it, you ensure assess safety during the interventions, and then now you communicate the planned interventions. And when you communicate the planned interventions, meaning that you document it, don't it? So you document the care that is given to the patient as well as the client's response to the care that is given to the patient. Do you understand? Another thing that we left out as well would have been prioritizing the planned interventions for the patient. So after you assess the patient, you reassess the patient, you're going to prioritize which one of the interventions you're going to carry out first. Right? So you prioritize the planned interventions depending on the client's condition, depending on the availability of resources, depending on the time, depending on the preference, what the patients want to do first. So you bear those things in mind. Understood?
Yes, miss.
All right, carry on. Carry on. You want to summarize the nursing considerations during the implementation phase of the nursing process. So we did the assessment phase. We're doing the implementation phase of the nursing process.
Miss, let me try, miss.
Yes, man. Then the child wanted to try, and then want to talking foolishness. Maybe say it's what that.
Yes.
Go ahead.
So you're in the implementation now. Oh, you were asking about the nursing considerations.
Yes, so you can start just as you were saying during the implementation phase of the nursing process, and this is how I want you to write in sentences. So during the implementation phase of the nursing process, the nurse would and one.
Reassess the client, miss.
Mm-hmm. And when you're reassessing the client, give me some meat on it.
So
In this case, you
check like the vital signs are given. Miss?
hear it.
Miss what you said?
Continue. Let's continue. So when you're reassessing the patients, you would do what?
Miss,
You check the vital signs to do what? Why you check the vital signs?
Before you make your implementation, because if you're going, suppose you're going to administer medications or so for the condition that the patient is having, and it was done this morning, but it's at a particular level, you would want to know reassess to see how the patient have responded to the
All right, so you want to, okay. So when you are answering, all right, pause, Miss Foster. When you are answering questions, I don't want I want you to write as you would write an academic paper. I don't want you to write simple. So reassessing the client, why is it that someone should reassess the client? Can someone else answer me? Why is it that you as a nurse need to reassess the client? Because vital signs is just one example. What if it is a dressing that you were going to do? Why is it that you need to reassess the client?
To check if the intervention needs to be changed or amplified.
Okay, Donalisa, is you there? Check if the interventions need to be changed. Yes. Anything else? Yes, that is correct. Anything else?
And you also to check if to check the patient's limitations.
All right, good. So you assess the patient and to update the database to update the database. So to update the database, to check the patient's limitations, to ascertain, to make sure of the patient's limitations, to see if the interventions that you plan to give must be adjusted to see if it is still relevant, if it needs to be adjusted, if it needs to be changed, right? Then you do what? So that is reassessing the client. Then you do what again? So reassessing the client is one thing you do when you're implementing your interventions. What else you do? Miss Christian is online. Miss Gaina is here.
Yes, Miss, I'm online.
Tell me what else you need to do in the implementation phase of the nursing process.
Mr. would determine the nurse needs for assistance. So you can also gather equipment to assist if needed, or get a next nurse to assist you if it's needed.
All right, wonderful, Miss McCray. Anything else you need to do?
Determine the level of knowledge or skill need to assist the patient.
All right, so that would come under determining the need for assistance, right? So when you're determining the needs for the need for assistance, you basically want to know you're going to do something. You need to know if you need help. You identify the limitations of the patients to determine the type, if the level of the type of help you need, how much help you need. So whether or not you need a male porter to come and set you who have the muscle to come help move the patient, whether or not you need another nurse, whether or not you need the doctor. You understand, to determine the level of help, the level of help or the type of help and the type of help that you need. When you're determining the assistance, you gather now, this is where now you gather the adequate equipment, whether or not it's people, you say, I need 3 man, I need 2 man, right? Whether or not you need a scissors, you need dressing set, you need a tracheostomy care set, you need a mouth care set, right? And you bearing in mind the level of skills, your competence, right? Based on your competence level of skills. So determine the competence in all that is needed to perform the interventions. What else you do?
You ensure the safety of during you conduct your delegated planned intervention now. So you would, after you have everything, you would let no one carry out your intervention.
Your delegate.
Your delegate, yes.
Because it's not everything you can do. You have the patient care assistants or the porters them who can do some of the things them. So you say, all right, you come hold up the patient here, so hold up the patient leg for me, please, while I perform the dressing. All right, so you delegate stuff. Or you say, all right, can you go for a bedpan for me, please? You understand? Yes. So you perform, all right, and during that now, you ensure safety of the patient during the intervention, don't it?
Yes.
All right, and then after you do everything now, what you do?
You make sure you are knowledgeable of the side effects also, miss. And then you communicate.
All right, you communicate.
Document.
Yes, communicate. So when you communicate, remember that in communication is either you communicate written or verbally. Understand?
Yes,
Yes,
miss.
miss.
All right. All right. All right. All right, sir. All right. Then now we are going to go now to the admission, transfer, and discharge. That's the next topic. Admission, transfer, and the discharge of patients. Tell me what you know about it. When a patient is being admitted on the ward, what is your responsibility as a nurse?
Miss, you have to interview the patient or the relative, the next of kin, depending on the condition that the patient is in. Maybe they cannot give a history. You have to get a history from the patient, biological data, health history, medical, surgical history, why the person is here for admission and all of those things.
Okay. I don't want to hear that, I'm not asking you all of those things.
Miss, I
You must tell me
understand.
all of those things. I need you to tell me the all of the things. All right. So what you said was correct. Anybody else?
Miss, first I prepare the client room, miss.
All right. So prepare the client environment. All right. What else you do?
You orientate the patient to the
Orientate the
ward.
patient to the ward.
Yes, you show them where the bathroom is, and you tell them about the visiting time.
What else you do?
Welcome the client, miss.
All right.
You can
What else you do?
introduce the client to other patients.
Okay. What else you do?
You make the patient comfortable in bed. You carry their bags to the bedside.
All right. All right. All right. What else you do?
Safeguard valuables and clothing.
All right. All right. What else you do?
This assessment.
What else you do? What else you do?
Compile the nursing database, including the signing of the hospital authorization form.
Okay. All right. What else you do? All right. You don't create a report with the patient first, don't it? All right. So let's go now. So you basically have the ideas of what to do, but in writing the essay and with remember that I mentioned that when you are completing your questions, you are to give pointers. So if you are asked for telling me 5 things that the patients do, you are to write down the 5 things and explain it. Write down the 5 things and explain it. So one, you write one, explain it. Right? Alright. So you number one, create a therapeutic relationship with the patient, don't it? So create or establish a therapeutic relationship with the patient, don't it?
Miss, because you want the patient to trust you.
Don't feel comfortable.
Alright, so, alright. Alright, so you create or establish a therapeutic relationship with the patient. So you be friendly and courteous, being friendly, courteous. You're gonna be greeting the patients and the patient's relatives, and you're gonna be introducing yourselves to them. That is the first thing that you would do, or one of the things that you would do. All right. Then you would ensure comfortable environment for the patient. So you would so you make the patients ensure. So you would ensure or create a comfortable environment for the patient. And when you're creating the comfortable environment, what will you do?
You have a bed prepared, a place ready.
Surrounding is clean.
All right.
Less noise.
Proper lighting.
All right.
And
to ensure safe. So you ensure the environment is safe if anything on the floor. So safe, clean, and what you say? Noise free. Quiet. Clean. Quiet environment. Introduce the patients, as she mentioned, to the ward. Because when somebody comes to your house and you want to make them comfortable, you receive them cordially and you ensure that the environment is safe and clean. You introduce them to the other persons on the ward. You help them to clean up themselves. Because when persons come on the ward, you change off them clothes and all of those things. So you assist with personal hygiene. Assist with personal hygiene and clean and arrange for clean clothing, don't it?
Yes.
All right. What else you do now? To verify the patient's identity, you want to know that is who the patient is, don't it?
Yes.
All right. So another thing that you do is to ensure the patient's identity. So you check the patients so that you can address them by their correct name or their correct title. So you verify who the patient is, you verify the patient's identity in order to address them appropriately. Then after that, you can make proper observation of the client's condition. So you ascertain the patient's condition. So you observe the patient's condition and you record and you report it. So you complete the admission record. This is where now you complete the admission record, collect the history, and you carry out the physical examination. Understood?
Miss, could you repeat? You observe the patient what?
You observe the patient's condition, record and report. So you can say you validate or observe the patient's condition, record and report. Verify. All right, let me use verify. So you verify the patient's condition, record it and report it. So this is where now you would complete the admission record. You collect the histories and you do your physical assessment. You getting it?
Yes.
All right. Then you would now orient the patient, as Mrs. Adeline said. You orient the patient and their relatives to the hospital ward as well as the policies of the hospital. So you orientate the client and the relatives to the hospital and ward policies, to the policies. So this is where you would familiarize the patient with the ward and the toilet, the toilet, the bathroom, drinking water, where the nursing stations is, where the treatment room is, and you tell the patient about the routine things that occurs on the ward. So you're gonna tell them about what time is ward round, what time is visiting time, what time is meal time, that sort of thing. Am I understood?
Yes, miss.
All right. So this is the orientation now. Then when you admit them now, you orientate them now, everything now, you're going to carry out the prescribed treatment for the patient. So this is where now you carry out the prescribed treatment for the patients. So carry out prescribed treatment for the patient. So this is where you would provide the supplies and special equipment, and you will make sure that all equipment is in working order, is in working order before the patient's admission. So you carry out the prescribed treatment for the patients. So at this time, nurses can also commence the orders. Commence the treatment orders. All right. You're also going to observe when you're admitting the patient. You, as the nurse, should observe the legal and ethical aspects of care and how you manage the patient. So you would adhere to required legal and ethical principles based on hospital standards. Anybody don't get to Jody yet? And the gentleman.
Miss Jody, phone look like it's not working.
She lost her phone, miss. So I communicate with her through another phone, but she's not responding.
Okay. So you would adhere to the required legal and ethical principles based on the hospital standards. So based on what the hospital requires as well as your professional standards. Adhere in the management of patient. So adhere to the required legal and ethical principles based on hospital or professional standards relating to the management of patients. And in this instance now, the meet on it now, you're going to recognize, you're going to observe guidelines poor Miss Roden just joined. Wow. So, Miss Gainer would be going down there. Miss Roden, welcome. All right.
Thank you, but the internet going to drop out again shortly because I'm not home myself.
All right. So distinguish guidelines relating to providing information about the patient to the family members. So you know that as a nurse, you can't tell everybody the information. Only the next of kin is given information. You're going to also adhere to consent. Ensure that consent is given. Consent for treatment is given. Especially for persons as well who consent is given for everybody as well as for persons who cannot express consent for hospitalization. So you're going to adhere to the required legal and ethical principles based on the hospital or professional standards related to managing your patients. And in this, I mean that you're going to establish guidelines, adhere to the guidelines, know the guidelines that relates to provision of information about the patient to family members and their next of kin. You're also going to pay special attention to consent for admission. So consent for admission from persons who are ill, who can give their consent, as well as persons who are ill, who are not in a position to give consent. So we're talking about patients who may be unconscious. We're talking about patients who are mentally ill. And with those persons who are unconscious, you're coming into an unconscious state, you cannot give permission for treatment. If you're coming as a mentally ill patient, you're not in the right frame of mind to give okay for treatment. So in this case, it is the medical officer of health in charge of the hospital who would give that consent for the patient. Talking about patients too who are in detention or penal institution in prisons also, who give consent for them to get care. So the medical officers of health who is responsible for the hospital would give consent. And the senior medical officer of health for in this instance for Percy Junior Hospital is Dr. Wilson. So Dr. Wilson, and the one from Mandeville, I think, I'm not so sure if it is still Dr. McIntosh. So those are the senior medical officers of health. Another thing that you need to do when patients are admitted is to safeguard the patient's belongings. So patients' valuables and clothing are to be handed over to the relatives with proper recording, or you lock it away safely until the relatives or the next of kin come to get it. When you are admitting a patient, it is very important for you to practice appropriate infection control measures. So you isolate the patients if they are suffering from communicable diseases, and you as the nurse would ensure that you use the appropriate PPEs with the care of your patient. Understand? Sorry.
Yes, miss.
Okay, when you're admitting a patient, it is very important again for you as the nurse to ensure that you attend to the needs of the patients without delay. Right? So you recognize the needs of the patients, you recognize or you attend, recognize or you attend to the various needs of the patients and without delay. All right? Without delay. So in this instance, you must understand the anxieties and fears of the patients and help them to overcome them. All right? You as well, you the nurse, should find out the likes and the dislikes of the patient. So you identify what the patient eat or what the patient don't eat. If the patient love bathe with hot water or cold water, all of those things are your responsibility. So you find out the dislikes and the likes of the patient so that you can include it in the plan of care. Understand? My friend,
Yes.
include in the plan of care. And always remember that you need to document. So in documenting after you've admitted the patients, it is very important when you have admitted them that you need to document them. Document in the nurse's notes, so the nurse completes all the documents, the nursing assessment forms, the as required. Information should include vital signs, the height, the weight, allergies, all of those things, laboratory investigations, and the results of physical assessment. So all of those should be documented. Am I understood clearly?
Yes, ma'am.
Yeah.
Yes, ma'am.
All right. Venice, Miss Gaina is with you?
She's off, miss.
Oh, okay. Okay, she
Yes,
fell
I
off.
think they live separate places. Mrs. Gainer lives in Maypen.
Okay. All right. All right. All right. So that is admission. When you're discharging the patient now, what is very important for you to, what is your responsibility as a nurse when you're discharging the patient? Because be sure you say I hear the one I'm telling me say I want to discharge patient. I want to write up discharge, I want to in admission and something of a person junior. All
This
right.
writes up the discharge slip, miss.
So all I want to do I write up slip. so
Miss, you need to teach the fit to discharge teaching, miss. You need to teach the patient about the medication that you're home with.
what else? Alright, what else?
You
Y'all go write up.
tell the patient to call the family members.
Say again, Miss Adeline.
You tell the patient to call family members.
Alright, so you tell them to call family members. I'm going to tell you how you write that. How you write that. Because if you're going abroad, you're not going to write that in the docket abroad of America. So this is a simplified. So you at least you remembered what you do out here. But we need to write something in a form that is recognizable everywhere. All right. So tell me what else you do when you discharge. So first I say you write up the slip. You tell the patient. You teach the patient. I don't remember what you say. You teach the patient. What else you do?
Miss, you explain the paperwork. So that means if they get medication.
Which paperwork? What kind of
All
words?
right,
So we
Miss.
can use some words. So.
All right.
What kind
So
of
for
paperwork?
instance, all right, Miss. So for instance, a person.
I don't want to hear the for instance. I need you to answer me in complete sentences. Give me statements.
All right. You're going to review the medications that the patient gets. You're going to ensure the patient of the correct route, the time, and how the patient should take the medications.
Oh, so that is on medication. They're telling me about medication. So they remember that is 1 point. Medication. What else?
All right. And if they refer the person to, say for instance, the person gets a referral to go to the outpatient clinic in their area, the nurse also tell them of the follow-up or if they should come back to the hospital that they are. And ensure to teach the family members also. Say for instance, when the patient goes home, the patient
I don't want to hear any for instance. Because you cannot write for instance in your list.
The patient goes home, so the family members have to ensure on what diet the patient is and ensure that the patient eat right in order to follow up care.
Okay, so we're talking about follow-up care there. All right. Okay, Sonia, thank you. Let me just continue now. All right, so discharge instructions, your responsibility. So the nurse's responsibility relating to discharging of a client from hospital includes one, ensure continuity of care to the patient, or if you want to say, ensure follow-up after discharge. All right. So ensure follow up. I'm trying to make it as simple, the explanations to be as simple as possible for you. So ensure follow up or continuity of care after discharge. So if the patient is supposed to come back to the hospital or if the patient is supposed to be followed up at clinic or for dressing or for any reviews. So ensure follow up, and this is so you obtain. So continuity of care would include obtaining prescription after retaining the medicines to be continued for that day. So into continuity of care. So if this morning the doctor discharges the patient and there was an order for the patient to get medication, there was an order for the patient to get required dressing, you would ensure that medications are given. So obtain discharge prescription after retaining the medicines to be continued for that day after discharge. Send all the continued medicines for that day and after discharge. So the patient had the medication from the pharmacy. They had it on the ward, and doctor say so. The pharmacist doctor had ordered 3 doses of medication. 3 days of medication, for example, and it is day 2 after doctor ordered that the patient is to be discharged. If the patient is on discharged on the same medications, you're going to send home the patient with the medication for them to continue taking it until they have gotten the chance, for example, to buy the medication. If it is the same one that they're taking in the hospital, doctor ordering it for them to go home with, right? Ensure that the patient is instructed regarding medication, regarding follow-up care, regarding outpatient visits, etc. If the patient requires any home care, you ensure that the patient knows about the home care and you make arrangements. What if the patient requires what the thing now wheelchair or what's the thing under your arm? Walkers, tread walkers, those things. You crutches, good. You make arrangements for those things, or you obtain a referral as well with the appropriate place to get those things. So the patient is good. The patient has lost a limb, and the patient is for discharge. You start asking the patient about the availability of crutches or walkers or wheelchair and stuff. If the patient don't have any money, you know the social services that you're going to recommend or talk to the social worker about provision of those supplies as needed for the patient, because the patient needs those things to move around when they go home. So that is one. Ensure follow up and or continuity of care for the patient. And these are some ways that you would do that. You make sure so you collect the prescription for the patient to go home. You ensure that the patient's medication is available for them to go home. You ensure that arrangements are made for any referral, and if the patient needs any devices to use, you ensure that those are provided or arrangements are made for the provisions of those. Am I clear?
Yes, miss.
All right. Another thing you have to do, you have to check the doctor's written order for discharge. So even though doctor may be walking on the ward round, doctor say, okay, I'm going to discharge this patient. You have to check the record, check the docket for the written order for a discharge. So obtain a written discharge order from the physician. If the patient discharges himself against medical advice, obtain and allow the completion of the appropriate form. So you have to check the doctor's written orders for discharge. That is number 2. Then you are going to assist or instruct the client to obtain a discharge summary and medical certificate as needed. So the patient is going to, for the continuity of care. So the patient is gonna go home now for the continuity of care. So you're going to ensure that the patient has a discharge summary. What is a discharge summary? Miss Foster, I'll let you write up this, Miss Foster. But what is a discharge summary, ma'am?
Yes, the discharge summary is a summary of the patient medical history. Why the person was admitted, you would have like the provisional diagnosis or the final diagnosis, what medication was given, and all of those.
So the discharge,
like a summary.
What is all of that? What is all of that?
I don't remember everything I don't remember everything, but all right, whatever diagnostic tests were done, it would be on the summary. Whatever medications were given, diagnosis, that is on it as well, and the prognosis also. And
what is the prognosis for those who may not understand what is prognosis?
What like the outcome? How would the patient? How you expect the patient? Would the patient recover fully or in parts or however? And also follow-up visit is also on it. Whether the patient is to come back in 2 weeks or come to whichever clinic, whether it's medical or surgical follow-up.
Thank you so much. Thank you so much. Boy, you come like you do 2 little days up at hospital, you get very vocal and bright and so. Is why you're resting more?
Miss, no, Miss, I'm like that all the time, but it's just that way I'm not at work. Sometimes I can't get the time to speak. So I can't get this, not convinced.
All right. So you're going to assist the patient, and you're going to instruct them to get a discharge summary and a medical certificate. All right, for outside, for continuity of care outside the admitting facility. Miss Clive, I don't hear you. I don't hear you.
Miss, the garbage trucks are passing at this time. My background is very noisy, Miss, so that's why.
All right, me no want to hear you. Everybody understand? Say we're not in a no private. We're not in a no private. We understand runnings. That is what the online facility. We understand runnings. We're not private. All right. Then another thing that is your responsibility is to, as Miss Adin mentioned, you inform the patient and relatives about discharge. So Miss Adin had said you call the patient and their relatives. So Miss Adin, you are going to inform the patient and their relatives about their discharge. Right? So you document the relevant discharge information in the patient's docket. All right? So document the relative discharge information in the docket. Then you accompany the patient to the transport near the exit gate. So accompany the patient. So accompany the patient from the ward to their transport near the exit gate. All right? Then you assist the patient to return to a state of optimal dependent living. So this is where you would now want to this is where you'd want to educate as well. Educate. You hearing me, McRae?
Yes, Miss.
All right. So you assist or educate the patient to return to a state of optimal independent living. Remember that anybody who gets ill, something has gone abnormal with them, right? So they may be walking, because I was in an area the other day, and when I saw that everybody was so well, when it came down to the nitty-gritty of things, I realized that everybody in the church sick, basically. For example, there was a member who needed blood transfusion. And when we were asking persons, because every day you see people up and down, and you think say them hearty. And because persons tend to see that if you're not crippled, or you have any visible impediments or so, everybody think that you are okay, right? So this is where now as long as someone is ill and has been admitted, something abnormal has happened to them and they come to the hospital for correction. Am I correct? So when they are going home now, you are going to educate them or assist them. Educate them on how to return to how to live most optimally, the best way possible, how to live independently with their condition. So in order to do that, you have to involve the patient's family in the discharge planning so that they can understand and understand whatever needs to be done, understand and perform the procedures for and with the patient. You're going to review the procedures the family will perform at home, and if necessary, demonstrate these procedures. You're going to also provide instructions for them and allow them to do return demonstration. So you're going to educate the patient. Educate the patient on ways to continue to live optimally, on ways to live optimally within their current state. And in doing so, you're going to teach the patient, involve the patient and the patient's relatives in their care. You're going to review the instructions or the procedures that needs to be done at home. to review the instructions or the procedures that needs to be carried out at home. You're going to give written instructions to them, and they are going to demonstrate the procedures that they need to do at home. So, for example, they're going home on insulin therapy. They need to give themselves insulin injection. So you're going to show them how to do it, show them what kind of insulin it is. You're going to read the instructions for them and go through the instructions with them. You're going to demonstrate how you give the injection, how they have to give their injections, and allow them, even the last time or so, to give themselves the injection so that you understand that they have done it correctly. So remember too that discharge teaching begins on admission. So it's not the last day that the patient is going home. You're going to be filling them with all of this information. During their admission to the facility, you say the relatives come, you give them little bits and pieces of information. You know, if they ask you questions, you answer them correctly. Or you can instruct them if they understand what is wrong with the patient. Because you know the patient is gonna go home on insulin, for example. Right? You can ask them if they know about it or so. Allow the patients to involve the relatives or their caregivers in their care. Before the patient is discharged, you have to ensure, Ms. Foster Campbell, that you perform a physical assessment. So even though doctor said the patient must be discharged, before you let out that patient out of the hospital ward, you need to conduct a physical assessment of the patient in order to detect any abnormalities that may have developed from doctor gave the order for discharge. If there are any abnormalities, you notify the physician and you delay the discharge until the patient has been seen. Right? So before them come out, you make sure that you physically assess them and ensure that they're okay to go home. And last but not least, you need to document. So what you need to document when the patient is going home. Tell me, Ms. Foster, what you documented.
When you would document the physical assessment findings, Miss, or you find the patient, you would document that the discharge teaching was done and you would have instructed the patients or educated them on all the necessary information that we discussed above. And you would also document that the patient left the ward with family members, maybe in a wheelchair, or how the patient left the ward, the condition the patient left the ward in.
Okay. All right. Anybody else? All right, thank you. Anybody else? Charlene, how you quiet, so?
I'm not feeling so well.
Okay. What else you would document? Anybody?
Miss the discharge orders and the appointments given.
Okay, Vanessa. Good. What else?
The medication that they get to take home.
Good. Anything else? The time and the date.
Oh, Miss, Miss, but we would automatically write that, Miss, first.
No, I have to know that you will write that. So you would record the time of discharge, time and date of the discharge, the patient's physical condition that they're in, any specific instructions, any procedures the type of procedures that they need to do when they go home, the medication that they're going home on, the follow-up appointments. So if they need to come back at a certain time, the dates of the follow-up appointments, the mode of departure, whether or not in a wheelchair or walking or so, the name of the patient's escort, so who the patient was escorted with, as well as the summary of the patient's care during hospitalization. So those are the things that you would have documented. Am I clear?
Yes, teacher.
Yes. All right. So review discharge. So again, so you would review the discharge of the patient. Any questions?
Yes. So, Miss, for the exam, we're gonna get 2 essay or 1.
So you're going to get 2 essays for you to do 1.
Oh.
All right. So remember, the last exam persons attempted the two S's. There is two S's. The big old instructions is up there. We are going to get two S's, so you answer only one. And the topics for the essays on the nursing process and this admission, discharge, and transfers. All right. Other areas that you should focus on. Positioning of the patient, transferring of the patient, for example, from bed to chair, from wheelchair, from bed to chair, from stretcher to bed. Those things you need to review. You need to review about teaching and learning. You need communication in general, so how you communicate with a patient. So how you communicate with someone who is blind and someone who is deaf. When you're giving instructions to someone who is blind, what would you do? How would you communicate with them, McRae? How you talk to them, giving them instructions? McRae?
Yes, miss. When you communicate with, trying to communicate with someone that is
Blind or deaf.
Boy, you know, you couldn't show any pictures. You would have to just speak in a way, speak fluently, and so they can understand.
So they can hear loudly.
Yes, miss. And understand.
All right. For someone who has memory problem, how you communicate with them?
Show them pictures, miss. Show them pictures so that it might can help them reflect on that specific thing.
Or you write it down, miss?
Yes, miss.
Suppose they can read.
How would you tell me how you do that?
Well, miss, you'd have to have the next thing there when you are communicating important information.
Or you would give them simple instructions.
Yes, it's a very simple instruction because probably anything you tell them, they're just not going to remember. Make sure our relative, our next of kin is there.
Mister, you can also find a quiet place to speak to the person at a specific time and don't rush them or interrupt either.
Okay.
And also listen to them.
Okay.
And again, the therapeutic way, miss, you also have to make them feel comfortable.
All right. When someone is being admitted to a hospital, you see, if the patient complains, tell me which one of these are priorities. The patient is complaining of pain, or they're crying, or they're moaning, or they tell you that they want their medication no, or the client take marijuana at home or stuff. Which one of the information you think you need to address as priority? Which one of the things I told you before? Priority.
The pain.
I'm the groaning.
Pain, miss.
The pain.
Anybody else? You're admitting the patients, for the first time. And they tell you that they take a lot of over-the-counter drugs and they smoke ganja at home regularly. They want some a higher dose of they used to take pethidine or so, and they want a higher dose, and them crying and them moaning and them are them telling you that they're having pain about 6 out of 10. Which one is priority for you to address?
The pain first.
No.
Miss, since the patient has taken marijuana as well as other drugs, we would need to bear in mind that if we give that patient any medication, it would not be as effective because there's marijuana in the system. So we would then have to try to maybe get rid flush the system or so, miss.
All right, wonderful, wonderful. Suppose you're admitting a patient and the patient are going like Virico. What you going to do? Aggressive and stuff. What are you going to do?
Call psychiatrist.
Yeah, then. It's not everybody have psychiatrist. That's why I want you to stop thinking out of the box. What I want you to do is to stop think as I want you to think generally at any facility, whether home or abroad, not necessarily to your institution that you have worked or is working. This is a training that looks at international standards of practical nurses, of assistant nurses. So I don't want you to tell me about any psyche aid because then I have no psyche aid over Cayman.
Miss,
Then I have
speak
no
to them
psyche
calmly.
aid. Tell me what to do.
Speak to them calmly, miss.
Have to try and calm the patient, miss, as best as they can.
Okay, so you speak to them as calmly as you can. What else would you do?
Reassure the patient.
You reassure the patient. You reassure the patient. Anything else? Anything else?
Mister, let them explain to you what is happening.
You as a nurse, you have to report it immediately to the nurse in charge, all right? All right. All right. You're talking to a patient and you realize that they have a problem with literacy. So you are talking to your client and you realize that them thinking not so righty, right? Them not understanding, them not thinking critically, then their head not part no good. What would you do to the patient? No, let me rephrase the question. How do you know how do you identify that a patient is having a literacy problem? When they're giving a lot of excuses, someone who gives a lot of excuses, you give them information and them give you a lot of excuses, everything, them just rebutting and finding rational for what they do? Or is it that they recognize that they don't know the information that you give them, or you see them follow the instructions that you give them, or you see them reading the instructions slowly? How would you identify that the person has a literacy problem? When they read, you're giving them the instructions and they're reading it very slowly, or they follow the instructions, or they tell you that, Miss, I don't know the information, or they're giving you a lot of excuses and a lot of rationale for not reading the information. McCray?
Miss, when they tell they don't know it, or I'm not understanding the question properly.
You're not understanding the question if you answer it like that. Anybody else?
Giving excuses.
Yes, giving excuses. So that is why the whole giving excuses. Anytime you see somebody, when you talk to them and then just a chat and rationalize the foolishness, the mere fact that a teacher comes to you and is giving you instructions it simply means that you are not saying what you're not meeting the requirements. And that is a cue for you to understand when you in exam, for example, and a lecturer might say, "Are you sure?" And they may be asking you the questions. It's not bother your examiners or your lecturers want to bother you. You are, for example, you and I are having a discussion here now, and you're noticing that I'm telling you that are you sure? That is to say that you're not saying the right thing. So when somebody have a pattern, they're giving excuses, this whole heap of excuse, it would say this as somebody here coming like saying the right thing. Because you're not when you say you don't know the information, you're admitting that you don't know the information. Nothing is wrong with that. Because you realize that you don't know it, so you're going to find out. Right? If you adhere to instructions, that means you're intelligent enough to know that if I follow the instructions, it will benefit me. All right. All right. What are some of the things that facilitates learning to take place? What are some of the things that encourages learning? And say it's 7 minutes to it's 3 minutes to 7 now, so I'll give you 5 more minutes. What are some of the things that enhances learning?
Motivation is one.
Mm-hmm. What else?
A change in behavior.
Mm-hmm. Facilitates learning. That is the result of learning. Change in behavior, the result of learning.
Would the type of method used for learning?
Method facilitates learning. Yes, the type of method too.
It's the learning style and their environment.
The learning style and their environment facilitates. Yes, that is true. Hold on. Let me go to this. But basically, the motivation facilitates learning. Hold on, let me see.
The level of intelligence.
Yes. All right. When you're teaching an adult client, what is it that you need to do? What is technique do you need to do to implement teaching so that it is mostly effective? What do you need to bear in mind when you're teaching adults to facilitate learning?
You need to bear in mind the adult learning style.
Wonderful. What are the learning styles?
Visual, auditory, kinesthetic.
All right. Good. so which of the following factors best facilitate learning? All right, so which one of the following factors best facilitate learning? And it is your motivation to learn. Because if you don't see the need to learn, you're not going to learn the thing. All right, and with identifying the client's learning style will better assist you in providing effective methods of learning. Let me see which other. All right. When you are conducting a teaching session, when you are going to be advising your clients, what should you as a nurse do to prepare to accommodate active engagement? Is it that you would want to know the patient's their social status, their likes and their dislikes, their physical capabilities, or their developmental stage?
The developmental stage.
The developmental stage.
All right, all right. When you're documenting something, you're documenting the activities of the day, and you forgot to write something. What should you do?
Late entry.
Late entry.
Late entry. All right. All right. Incident report. Incident report. What is an incident report?
This is that when something happened to a patient on the ward, say for example, a patient fall off a bed, so the nurse would have.
All right. So which one of these? All right. So which one of these? That something happens on the ward that must be reported. Which one of these do you think the nurse should write a complete an incident report for? If you see the infusion pump, the IV pump has the electrical cord on it is worn. If the medication is given to a patient 30 minutes after it is due, if there is a prescription that was written without the route of administration, or if the patient's dentures are lost after they have been transferred, which one should you as a nurse write an incident report for?
The denture that is in lost?
The denture is all lost.
Yes. All right. We spoke about documentation earlier. So when you're going to be writing information as it relates to the patient, the client's information, how do you ensure that the information that you're writing down is objectively written, without opinions or judgments?
Exactly what you see.
What you see and what the patient tells you.
What else? All right, so exactly. So you avoid the generalized statements, don't it?
Yes.
Specific. So you write specific statements. All right.
Yes.
Tell me the purposes of for documentation again.
For continuous
Accountability.
here.
What else? The purpose for documenting information. Tell me then.
To continue of care for communication, accountability,
Research purposes.
teaching.
All right. Wonderful. What position you put the patient in when they are giving them tube feeding?
Semi-polar position.
Okay.
Is it high, miss, or semi?
Semi or high. So anyone you give, that's fine. Tell me when you're feeding the patient, tell me the procedure for giving NG tube feeding. Tell me the procedure. NG tube feeding. Tell me what you do. What are the steps for me quickly?
Flush the tube and this when you're going to
use the syringe, empty syringe, pull it up with air mist, and you use the stethoscope at the where for the first. Oh man, if we forget the word, the exact word of the chest, the area of the chest mist, but you listen, you use the stethoscope to listen when you push the air in the tube mist, or you pull up this syringe mist. So you're pulling up the content of the stomach. And when you do that, you push it back in, then you rinse the tube with water. The amount of feed you need, you rinse the tube with some of the water, of that measurement of water, and then you after it goes down, you king, and you pour in the what do you call it?
All right. Thank you, Vernice. So you review NG tube feedings, right? You need to also review BMI, how you calculate BMI measurement, body mass index.
Weight over height meter squared.
All right, so review that. And what is the now? What is it if you're overweight? What is the BMI for someone who is overweight, underweight, obese, or normal weight? So you need to know the BMI of persons. When you're auscultating or when you're assessing the bowel sounds, what are some of the what is the technique that you use when you're auscultating the bowel sounds of the patients?
This is in the lower right quadrant. Is in the lower quadrant. Is in clockwise.
So you start in the lower right quadrant?
Yes, Miss Ice. Clockwise.
Okay. What else?
And you listen for the amount of clicks and gurgles in each quadrant.
Okay. And you auscultate before you palpate, don't it?
Yes, miss.
Yes.
When you're doing vital signs for a patient, what is the best position for you to put them?
Sitting.
Okay, sitting. Okay. When you're validating information, you're doing an assessment of the patient and you're validating information. Goes back to the essay type question. What do you, when you say you're validating information, what is it that is meant by that?
You're verifying whatever information that is the patient.
You compare the information given.
Okay. All right. Okay. You're auscultating the hard sounds. Miss Gainer is online. You're auscultating the hard sounds of the patient. Miss Gainer, you come?
Yes, she's here.
All right. All right. You're auscultating the hard sounds of the patient. Tell me about the S1 and the S2 hard sounds. The characteristics. Tell me about them.
Mr. S1 sound is the lob. The S2 is the dub. The S1 is heard at the apex and the S2 is heard at the base.
One is louder, saying S1 is loud at the apex and the S2 heard loudest at the base.
Yes.
So you need to find out about that. S1 and the S2 sounds over the cardiac points. When you're assessing the pulse rate of a patient who is unconscious, where you assess it? In an emergency situation. Okay. If you do an assessment of the person's blood pressure and you get an elevated reading, what should you do first? You get a reading of approximately 150 over 90.
So we're going to take it in the other arm.
All right. Why are you going to take it in the other arm?
To compare the readings, miss.
Why you going to compare readings?
Yes, but first you have to understand what the readings are. So you have to compare the reading against standards, against what the correct thing is. So any vital sign you take, you with it, the first thing you do when you take the pulse rate and you get 120, you're going to say, no man, this is not normal, because you know that the standard measurement, the first thing you do is check what is the normal measurement, what is the standard measurement. All right. So when you see examination questions, you check for terms like priority, best, first, not, except. Those words you look out for in your multiple choice question. So the first thing you do, you check it for standards, and then now you know that after you check it even before you do it in the next you're going to check you check for standards. You're going to check to see what were the previous measurements before, and compare it against this one, and then you're going to do it on the next arm, and then you're going to be comparing. If you use a cuff that is too small, what will be the likely result of the blood pressure?
False high.
False high.
Okay. All right. Tell me a little bit about the bell and the diaphragm of the stethoscope.
Mm-hmm.
What is it? What is the bell arm of the stethoscope used for, and what is the diaphragm used for?
The bell is used to listen murmur sounds or low pitch sound.
I say check to see which one listen high pitch, which one listen low pitch sounds. All right. Why am I asking the question, the exam, and the exam just sound hard to hold and not responding?
It's not going to give you exam question.
You need to study you need to review as well your conversion of centigrade to Fahrenheit and Fahrenheit to centigrade. You need to review that as well. When you assess the patient and you finish everything, what would you do?
Document.
Okay. What is a focused assessment? In physical assessment, what is a focused assessment?
Miss, when you focus on a specific area of the body that is affected.
Okay. What is an ongoing assessment?
When you assess a patient over a period of time during a particular time frame.
What is time-lapse assessment?
You see the answer?
An assessment to see how the patient reacts to the agreed treatment plan and how their condition is evolving.
Over what period of time?
After they have left the medical facility or so. So follow up.
All right. So follow up. So like when you say time lapse, you're just thinking of follow up. So if like the patient came to the doctor now and say, all right, giving you 4 months for review, 3 months for review. That is a time lapse assessment when they come back. Right? So like persons who are on the clinic and you say, all right, I have a clinic visit 3 months time. It's a time lapse assessment that they will get at that time. Ongoing assessment, the patient is admitted on the ward and during your shift then. After each procedure or during intervals during your shift on a particular day, you continue to do the assessment of the patient. That's ongoing. Focus assessment, patient comes in and tell you that something is wrong with them in a specific area. You just quickly go to that area and do the assessment of the foot. If they tell you it's the foot, the abdomen, if they tell you the abdomen, that is focused assessment. All right. You doing your head-to-toe assessment on a patient that you're admitting. Is it an independent action, a dependent action, or an interdependent action?
Independent action.
Okay. All right, I think that's it. So I've reviewed I've done the revision. I think those are the areas that you should focus on. So the nursing process, admission, transfer, and discharge, physical assessment plays a vital role in here because we need to understand that we need to see that you understand how a physical assessment is done. And so that is our focus right here. That is our focus right here. And Monday is your exam. I think I will be in the lab, so I'll come and view the paper before the exam. And if there is any adjustments that are to be made, then I will make it at that particular time. All right, any questions? So I've given you almost 2 hours, and I wanted to give you half an hour for 20 minutes. So yes, I'm giving you 1 minute more. Any question? Go ahead.
I'm actually the timetable is out. The timetable is out for the exam next week.
Oh, you haven't gotten the timetable?
No, miss.
I don't get it, so I'm not sure about the others.
Nobody has gotten it?
No, miss.
No, miss. No, miss.
So let me tell you what is the proposed timetable. It is supposed to be sent by the examination department. So we don't really have the it's not our responsibility. So you never know, say it's Monday you have my exam.
No, miss.
No, miss.
Oh, yes. Well, you know, the exam start Monday though.
Yes, miss.
Alright. So you have Sunday and Monday, as I have it here. The 23rd is med surge.
Miss, what time is your exam, please?
9 o'clock in the morning, ma'am.
Okay, ma'am, thank you.
Alright, 9 o'clock is med surge. PVD. You doing PVD?
No, miss.
Yes.
Persons are repeating PVD. They have it the 24th. If persons are Miss Glave or somebody, please write that down. The persons are giving psychology. Persons are doing psychology. You doing psychology?
I knew it.
This is the 24th at 1 p.m. Some PVD in the morning, psychology in the evening. So that's the 24th. You doing nutrition?
Yes, miss.
Yes. 25th. So I want to not get this something and nobody not ask no question. We not just go on like zombie stuff. How come you know 1 week to examine and they don't get
Miss,
anything?
I was going to say it to you later when I send the thing that you asked for.
No, man, you don't need to be vigilant, man. No. You need to be vigilant. Because just as how you asking me, just as how you asking for revision or some persons asked me last week if I'm going to be having revision and stuff like that. You don't need to ask up the questions then. It's for your good. It doesn't make sense keep it being silent and then it's trust on you. Yes, you know the exam time, but you should have gotten this. You should have gotten the exam thing from last week or probably the week before, if it isn't from last week. Because it's not our responsibility. That's why we don't. But the decision was made on it from when. AMP, person is doing AMP. It is the 1st of May. 1 o'clock. Sociology, you're doing sociology? The 2nd of May. 9 o'clock.
Miss, what is the time for nutrition, please?
9 o'clock a morning, man.
Okay, miss.
Pressure come out of the bed. Alright. So tell me what you have. So sociology, the 2nd of May. 9 o'clock. AMP,
1 p.m.
1 p.m. the 1st of May.
Nutrition, 9 a.m.
9 a.m. which day?
25th, right?
25th, they only get much time. After.
Miss, we did miss with this.
One course. Miss, so what about pharmacology?
Pharmacology, miss.
Who you doing pharmacology?
Yes, miss.
Yes.
One course, miss. It's one course.
What is it called? Pharmacology. You know the pharmacology?
Yes, miss.
Yes, miss, unless they're not, but I'll give you an exam.
No, it's easy.
Remember, we did practical the same time as your exam.